Most people trying to control their blood sugar are eating the wrong foods at the wrong time and wondering why nothing is working. But here's what almost nobody tells you. Certain foods can start pulling your blood sugar down within hours of eating them. Not days, not weeks, hours. If you or someone you love is dealing with high blood sugar, prediabetes, or type 2 diabetes, and you feel stuck, what I'm about to share could genuinely change your numbers by your next checkup. Stay with me, because by the end of this video, you will have a clear doctor-approved food list you can start using today. I am a physician, and I see patients managing blood sugar problems every single week. And one of the most common things I hear is this: "Doctor, I stopped eating sugar, so why are my numbers still high?" And that is exactly the right question to ask, because blood sugar control is not just about cutting candy out of your diet. It is about understanding which foods actively help your body manage glucose better and which ones are quietly making it worse, even when they seem healthy. That is what we are getting into today. Let us start from the beginning. Before we talk food, you need to understand what is happening inside your body when your blood sugar is high, because once you see it clearly, the food choices will make perfect sense. Every time you eat, your digestive system breaks food down into glucose. That is the sugar that enters your bloodstream. Your blood is not supposed to hold on to that sugar. It is a delivery system. The glucose is meant to travel from your blood into your cells, where it gets converted into energy you actually use. The key to that transfer is a hormone called insulin. Your pancreas makes it. Insulin essentially acts as a signal that tells your cells to open up and accept the incoming glucose. When everything works the way it should, your blood sugar rises a little after a meal, insulin kicks in, the sugar moves into your cells, and within a couple of hours, your blood sugar comes back down to a healthy range. Now here's where it breaks down for millions of people. After years of eating too many refined carbohydrates, things like white bread, white rice, sugary drinks, processed snacks, your cells start to become resistant to insulin's signal. The doors do not open as easily anymore, so sugar sits in your bloodstream longer than it should. Your pancreas works harder to pump out more insulin to compensate. Over time, that system gets exhausted. Think of it like a drain in a sink. When everything is clear, water flows down fast. But when there is buildup, when the drain is partially blocked, water just sits there and rises. High blood sugar is exactly that. The drain is partially blocked and sugar is backing up instead of flowing where it belongs. The good news, and this is the part most people are not told clearly enough, is that food is one of the most powerful tools you have to unblock that drain. Not every food spikes your blood sugar the same way. Some foods slow the flow of sugar into your blood dramatically. Some foods improve how well your cells respond to insulin. Some foods reduce the inflammation that makes insulin resistance worse. And that is what we are going to map out right now. Many people asking me that, why food choice matters more than just cutting sugar. Here's a misconception I want to clear up right away, because it trips up a lot of people. Cutting out dessert and soda is not enough on its own. Many foods that do not taste sweet at all still convert to sugar quickly in your body and spike your blood glucose just as fast as a candy bar would. White bread, white rice, cornflakes, crackers, instant oatmeal, baked potatoes. These are foods people think of as neutral or even healthy, but they are made of refined starches that break down into glucose almost instantly during digestion. Your blood sugar can spike within 30 to 45 minutes of eating them. On the other end of the spectrum, there are foods that break down slowly, barely affecting blood sugar at all. And when you eat those foods together in the right combinations, you create a kind of buffer in your digestive system that significantly slows how fast any sugar enters your blood. The measure we use to understand this is called the glycemic index. Foods with a high glycemic index break down fast and spike your blood sugar quickly. Foods with a low glycemic index break down slowly and cause a much gentler, flatter rise in blood sugar. But what matters even more than the glycemic index of individual foods is how you combine them, because fat, fiber, and protein all slow down digestion, which means they slow down the rate at which glucose enters your bloodstream. So when you eat smart combinations, you are essentially telling your body to release sugar gradually instead of all at once. That is the foundation of every food recommendation I am about to give you. Before we get into the food list, I want to make sure you recognize the signs that your blood sugar is already dysregulated, because a lot of people miss these completely. The mild signs show up first: unusual thirst, even though you have been drinking water, needing to urinate more than usual, especially at night, and a kind of low-grade fatigue that persists throughout the day and does not improve much with sleep. The moderate signs build from there: blurry vision that comes and goes, cuts and bruises that are healing slower than they used to, frequent headaches, and that specific afternoon energy crash, that foggy, shaky, irritable feeling about an hour or two after a carb-heavy meal. A lot of people blame stress or poor sleep for this. Very often, it is a blood sugar crash happening in real time. The more serious signs, numbness or tingling in the hands or feet, recurring skin or yeast infections, unexplained weight loss, these suggest the problem has been building for some time. Here's what catches a lot of people off guard. Women are more likely to notice fatigue and recurring infections first. Men more often notice mood changes, concentration problems, or changes in physical performance. Different presentations, same underlying issue. If any of these ring true for you, talk to your doctor about checking your fasting glucose and your HbA1c. The HbA1c tells you your average blood sugar over the past 3 months, which is far more informative than a single snapshot reading. Now we're talking about the best foods to lower blood sugar, the full list. Now here's the section you came for. Let us go through each food, what it does, and why it works. Leafy green vegetables, spinach, kale, Swiss chard, collard greens, arugula. These are the single best category of food for blood sugar control, and here is why. They are extremely low in digestible carbohydrates, which means they barely affect your blood sugar at all. But more than that, they are loaded with magnesium, and magnesium plays a direct role in insulin signaling. Studies have consistently shown that people with low magnesium levels have worse insulin sensitivity. Leafy greens are one of the most reliable ways to bring those levels up through food. Add them to every plate you possibly can as a base for meals, blended into smoothies, sauteed as a side dish. Fatty fish, salmon, sardines, mackerel, trout, herring. Fatty fish are rich in omega-3 fatty acids, specifically EPA and DHA. Here is why that matters for blood sugar. Chronic low-grade inflammation is one of the key drivers of insulin resistance. Omega-3 fatty acids are among the most well-studied anti-inflammatory nutrients we have. When you reduce systemic inflammation, your cells respond to insulin better. Aim for fatty fish at least twice a week. Grilled, baked, or canned, all effective. Eggs were unfairly villainized for decades. The science has cleared them significantly. For blood sugar specifically, eggs are ideal because they are pure protein and fat with virtually zero carbohydrates. That means they do not spike blood sugar at all. But here is the more interesting benefit. Eating eggs at breakfast has been shown in multiple studies to reduce blood sugar spikes at the following meal as well. The mechanism is partly about satiety. Eggs keep you full longer, so you eat less of whatever comes next, and partly about the way protein and fat slow gastric emptying. Starting your day with eggs is one of the simplest blood sugar strategies available. Beans and lentils. This one surprises people because beans contain carbohydrates, but they are uniquely structured carbohydrates. Beans and lentils are loaded with soluble fiber, which forms a gel-like substance in your gut that physically slows the absorption of glucose into your bloodstream. They are also high in plant-based protein, which slows digestion further. The result is one of the flattest blood sugar responses you can get from any carbohydrate-containing food. Black beans, chickpeas, lentils, kidney beans, rotate through them. They are filling, affordable, and genuinely powerful. Almonds, walnuts, pecans, pistachios, nuts combine healthy fats, protein, and fiber in a way that makes them nearly ideal as a blood sugar stabilizer. Eating a small handful of almonds before a meal or alongside a carbohydrate has been shown to significantly reduce the blood sugar spike from that meal. Walnuts in particular also contain omega-3 fatty acids and compounds that support insulin sensitivity. Keep a small portion as a regular daily snack. The key word is portion, about a small handful, not a full bowl. Avocado. Avocado is one of the most uniquely beneficial foods for blood sugar because it contains almost no sugar or starch. What it does contain is monounsaturated fat and fiber in an unusually rich combination. Monounsaturated fat improves insulin sensitivity directly. The fiber slows digestion. And the potassium in avocado helps support healthy blood pressure, which matters because high blood sugar and high blood pressure frequently occur together. Half an avocado on a salad, sliced alongside eggs, blended into a smoothie, it integrates easily in almost any meal. Apple cider vinegar. This one has some real science behind it, and it is worth understanding clearly. Apple cider vinegar contains acetic acid, which has been shown in clinical studies to reduce post-meal blood sugar spikes by slowing the rate at which food leaves your stomach. It also appears to improve insulin sensitivity. The practical use is simple. 1 to 2 tablespoons diluted in water before a high carbohydrate meal. Drink it through a straw to protect your tooth enamel. This is not a miracle cure, but the evidence is consistent enough that I mention it to patients regularly. Berries, blueberries, strawberries, raspberries, blackberries. If you want something sweet without a significant blood sugar consequence, berries are your best option. They are lower in total sugar than most fruits, and critically, they are high in fiber and rich in polyphenols, plant compounds that actively improve insulin signaling and reduce inflammation. Blueberries in particular have been studied specifically for their effect on insulin sensitivity with meaningful positive results. A cup of berries with breakfast or as a snack is a genuinely smart choice. chia seeds and flax seeds, these are nutritionally dense and specifically valuable for blood sugar because of their extraordinary fiber content. Chia seeds form a gel when wet that slows digestion significantly. Flax seeds are rich in lignans and soluble fiber that improve gut function and reduce blood sugar spikes. Both are also good sources of omega-3 fatty acids. Add a tablespoon of chia seeds to water or yogurt. Add ground flaxseed to oatmeal or a smoothie. Small amounts, big impact. Cinnamomide, or real cinnamon, Ceylon cinnamon specifically, has been studied for its blood sugar lowering properties. The compounds in cinnamon appear to mimic insulin to a small degree and improve how efficiently cells absorb glucose. The effect is modest, not dramatic, but it is real and additive. Half a teaspoon to a teaspoon daily in oatmeal, coffee, or a smoothie. Use Ceylon cinnamon rather than the more common cassia variety, especially if you are using it consistently, as high doses of cassia over time can have other effects. Greek yogurt plain, unsweetened Greek yogurt, is high in protein and contains probiotics that support gut health. There is growing evidence that gut microbiome health directly affects insulin sensitivity and blood sugar regulation. The protein in Greek yogurt also blunts blood sugar spikes when eaten alongside or before carbohydrates. Choose plain, full-fat, or low-fat Greek yogurt. The flavored varieties are often loaded with added sugar and defeat the purpose entirely. Broccoli and cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, cabbage. These contain a compound called sulforaphane, which has been shown in research to reduce blood glucose and improve insulin resistance. They are also high in fiber and very low in digestible carbohydrates. Roasted, steamed, or raw, these belong on your plate regularly, not occasionally. Garlic has been used medicinally for centuries, and the research on blood sugar is consistent. Compounds in garlic, particularly allicin, appear to improve insulin sensitivity and lower fasting blood sugar in people with elevated levels. Raw garlic has the strongest effect. Minced or crushed garlic in cooking retains meaningful benefit. It is easy to add to almost any savory dish, and the blood sugar benefit is a real bonus on top of its cardiovascular effects. OTs, specifically steel cut or rolled, not instant oats, steel cut or old-fashioned rolled oats, are a genuinely useful food for blood sugar because of their high beta-glucan content, a specific type of soluble fiber that has been shown in clinical trials to reduce post-meal blood sugar spikes and improve insulin response over time. The key is preparation. Cook them with water, add protein like Greek yogurt or nuts, and avoid loading them with honey or dried fruit. Instant oats are highly processed and behave very differently in your body. Their glycemic index is significantly higher, so they are not the same thing. Now we're talking about what to do if blood sugar is already critically high. Emergency steps. If someone has extremely high blood sugar, symptoms include extreme thirst, rapid breathing, confusion, fruity breath odor, or loss of consciousness. This is a potential diabetic emergency. Call 911 immediately. Do not attempt to manage this at home with food or water. If you are someone who monitors your blood sugar and you get a reading that is significantly above your target range, but you are conscious and feeling okay, contact your doctor or their after-hours line right away, rather than waiting to see if it improves on its own. Blood sugar that is consistently very high needs medical attention, not just a dietary change. If a blood sugar crash, a low is happening, meaning the person is shaky, pale, sweaty, and confused but conscious, a fast-acting sugar source followed by a small protein snack can help. But if symptoms do not resolve within 15 minutes or worsen at any point, call 911. Family members, knowing these signs and having a plan before you need it is genuinely life-saving. Blood sugar emergencies can escalate faster than most people expect. If you are managing blood sugar problems, the diagnostic picture typically includes a fasting glucose test and an HbA1c, which shows your average blood sugar over the past 3 months. Some doctors will also use an oral glucose tolerance test to see how your body handles sugar in real time. For prediabetes, lifestyle intervention, meaning diet, movement, and weight management, is the first and often most powerful treatment. For type 2 diabetes, lifestyle changes are still central, but medication is often needed alongside them depending on how elevated blood sugar is and how the body responds. There are several classes of medications your doctor might consider, each working through a different mechanism. Some improve how the body uses its own insulin, some help the kidneys clear excess glucose, others support insulin release from the pancreas. I will not go into specific drugs or doses here because that decision is entirely individual and has to be made between you and your physician based on your complete health picture. What I will say is this clearly: the foods in this video are not a replacement for medication if your doctor has determined you need it. Food is a powerful tool. Medication is a powerful tool. Many people need both. and there is no shame in that. What I see in my patients is that the ones who combine good food habits with their treatment plan consistently have the best outcomes. Nothing in this video is a substitute for your own doctor's guidance. Use this as a starting point for a conversation, not as a prescription. Leafy greens with every meal, fatty fish at least twice a week, eggs for breakfast instead of cereal, beans and lentils as your carbohydrate base, berries instead of other fruits for sweetness, nuts as your go-to snack, avocado regularly, plain Greek yogurt instead of flavored, broccoli and cruciferous vegetables consistently, steel-cut or rolled oats prepared with protein and fat. Avoid or sharply reduce these. White bread and white rice, they spike blood sugar almost as fast as straight sugar does. Flavored yogurt often contains as much sugar as a dessert. Fruit juice, even fresh juice, strips the fiber and delivers a concentrated sugar hit to your bloodstream. Instant oatmeal, highly processed, high glycemic index, not the same as rolled or steel cut. Breakfast cereals, even the ones marketed as healthy, are typically high in refined starch and sugar. Processed snack foods, crackers, chips, pretzels, these break down to sugar quickly with almost no fiber to slow them. Sugary condiments, ketchup, teriyaki sauce, sweet BBQ sauce, the sugar content shocks most people. A strong single day of eating for blood sugar looks like this. Breakfast, 2 or 3 eggs with spinach and avocado. Snack, a small handful of almonds and a cup of berries. Lunch, a large salad with grilled salmon, chickpeas, and olive oil and lemon dressing. Snack, plain Greek yogurt with a tablespoon of ground flaxseed. Dinner, baked salmon or grilled chicken with roasted broccoli and a side of lentils. That is not a deprivation diet. That is genuinely satisfying eating that happens to be very well structured for blood sugar control. Now what to avoid if you have not had blood sugar problems yet. If your blood sugar is still in the healthy range and you want it to stay there, here's the direct version. Do not drink your calories. Sodas, juices, sweet coffees, sports drinks, liquid sugar is the fastest way to damage your insulin response over time. Do not eat refined carbohydrates as the centerpiece of every meal. Build meals around protein and vegetables first, then add complex carbohydrates as a supporting element rather than the main event. Do not stay sedentary all day. Even 15 to 20 minutes of walking after meals is enough to meaningfully improve how your body handles the glucose from that meal. Do not ignore fatigue and afternoon energy crashes as if they are normal. They are data. They are your body telling you something is not right with how it is processing sugar. Do not skip annual blood work. A fasting glucose and HbA1c catches problems years before you would ever feel them. Do not smoke. Smoking independently worsens insulin resistance. Do not treat alcohol as a nightly habit. It disrupts blood sugar regulation in ways most people significantly underestimate. Now I give you some tips that can help you. Tip number 1, eat your vegetables and protein first at every meal, then your carbohydrates. This single change can reduce your post-meal blood sugar spike by a meaningful amount. Tip number 2, never eat carbohydrates alone. Always pair them with fat, protein, or fiber. Tip number 3, a tablespoon of apple cider vinegar and water before a carb-heavy meal genuinely helps. Use a straw. Tip number 4, 10 minutes of walking after eating is one of the most evidence-backed blood sugar tools available, free and effective. Tip number 5, sleep is not optional. One night of poor sleep measurably worsens insulin sensitivity the next day. Tip number 6, stress raises blood sugar through cortisol. Managing stress is not just psychological, it is metabolic. Tip number 7, frozen vegetables are just as nutritious as fresh. There is no excuse not to have spinach and broccoli available every day. Tip number 8, if you are going to eat something high glycemic, eat it at the end of a meal, not the beginning or on an empty stomach. 9, check your magnesium intake. Low magnesium is extremely common in people with blood sugar problems and is correctable through food. 10, get your HbA1c tested, not just fasting glucose. It tells a much more complete story. Closing here is the truth about blood sugar. Your body is responding to what you feed it every single day. Every meal is either making this problem worse or helping you gain ground on it. And now you have the exact list, not vague advice, not generalities, but specific foods with specific mechanisms that can start moving your numbers in the right direction. Start with one change today. Add leafy greens to your next meal. Swap your breakfast cereal for eggs. Take a 10-minute walk after dinner tonight. Small, consistent moves add up to real, measurable results. Your next blood test will reflect what you do between now and then. Make it count.